everybody. This is Andrea Paquette from Stigma-Free Mental Health Society. I'm the president and the co-founder. Super excited to be hosting our Stigma-Free Voices podcast today. Today we have Emily Wilkes. Hello, Emily. How are you doing? Where are you tuning in from? Let us know.
Yeah, good morning, everyone, and good morning, Andrea. Thank you so much for having me on today. I'm tuning in from Okotoks, Alberta today.
Oh, wow. Okotoks. Like, this is so random for some people. Whereabouts is that?
Yeah, so we're south of Calgary. We're probably about a 15-minute drive south of Calgary. We're a mighty community of around 30,000 people, and yeah.
That's amazing. I'm in Moose Jaw, Saskatchewan, and there's 33,000 here in this city, or town, I guess you could say. And I know what it's like to be part of a small rural community, and it's great, isn't it?
Yeah, it is. It's fabulous.
Awesome. All right. Well, I think we're going to start with me just sharing your bio. I think that'd be a good opportunity for our viewers to get to know who you are just a little bit, and then we'll jump into some questions and have a great conversation about rural mental wellness and mental health and all the things that I'm passionate about, most especially what you're passionate about, which is why we have you here today. Sound good?
Yeah, that sounds fantastic.
Okay. So Emily Wilkes is a community network coordinator with the Canadian Mental Health Association and Alberta Division and the Centre for Suicide Prevention, where she supports the Rural Mental Health Network. We're going to talk a lot about that. She works at the intersection of community development, strategic planning, and meaningful connection, bringing a strong background in stakeholder engagement and in grassroots leadership, which is very admirable. Emily is currently completing her master's in community development at the University of Victoria, which is where I went to, Emily, and has worked closely with rural communities, Indigenous organizations, families, and youth to support community-led mental health initiatives across Alberta. And this has been happening for the last 10 years. Her work is grounded in systems thinking, which is very important and vital, in my opinion, relational leadership, and a deep belief that mental health is shaped by belonging, connection, and community. So that is amazing. I really love your bio. And is there anything you wanted to just briefly add there, or should we jump into the questions? What are you feeling like?
No, that sounds great. Thank you so much for that. Yeah, and really looking forward to jumping in here.
All right. Well, I think the most obvious question is to learn more about you and your organization. So I know I covered some obvious points here, but I would love to just expand on that for our viewers. Okay?
Yeah, for sure. Absolutely. So yeah, as Andrea mentioned, everyone, I was born and raised in Alberta. I grew up in Calgary, and now I live in Okotoks with my husband. I'm the oldest of two siblings, and my family background has really shaped who I am, with my mom immigrating to Calgary from the Philippines and my dad being a Canadian resident. So I grew up with an appreciation for different perspectives and the importance of community and support. And ultimately, that background is a part of what drew me into nonprofit and community development work, again, with a focus on centering relationships, local leadership, and community-led change. And as Andrea mentioned, I work with the Canadian Mental Health Association in the Alberta Division and Centre for Suicide Prevention. And together, we play a really unique role in Alberta by uplifting, connecting, and enabling organizations and community leaders so that mental health and suicide prevention programs can be more coordinated, effective, and impactful. So ultimately, the goal of strengthening communities and creating pathways to mental well-being for everyone. So our work is guided by our values of inclusivity, collaboration, innovation, with a focus on prevention, which ultimately really shapes everything we do. Mm-hmm. And as you mentioned, Andrea, my role and my position, I'm with the program, the Rural Mental Health Network. And that's one of the ways that vision really comes to life here in Alberta. It's a community-led initiative supporting rural communities to build mental wellness in a way that really ultimately makes sense for them. And as you mentioned, my role, I'll just a little bit more about that.
Yeah, please do.
Yeah, so I support the community animators who lead this work. I help them with connecting with others in the network, sharing resources, creating spaces for learning and collaboration. And honestly, personally, it really resonates with me because I've always believed that mental well-being is strongest when it's built together at a local level rather than delivered from the outside.
Mm. And sometimes a tapestry of both, right? Like I can see that definitely being relevant as well. But I love how you talk about the connection and belonging and community. Because I know when I was diagnosed with bipolar disorder, the one thing that I truly needed was belonging and having that feeling that, I have a tribe. I have people who are looking out for me and care about me. That's important, isn't it?
Yeah, it really is.
Yeah. Okay. Well, you didn't talk about your master's in community development, and I love you, Vic. I've spent many years there, and I was wondering if you could tell me a little bit about the education and how it relates to your work. I would love to hear more about that.
Yeah, so when it comes to my education, it really is, like all about, how it really, you're taking like the academic pieces and really tying it back to that work in reality. And so, with my master's in community development, it really, pushes me to ask the questions around like, who has access to support, whose voices are being heard, how do these systems either make it easier or harder for people to thrive? Ultimately, when systems aren't designed with rural realities in mind, people can tend to fall through the cracks, not because they failed, but it's just because the system wasn't built for them.
Yeah.
So, yeah.
Okay,
Yes.
well, I love you're sharing this, and I want to know, like, how did you get interested in mental health?
Yeah, for myself, it really comes back to my own lived experiences. And so ultimately, it started, from a place of curiosity about people and community. As a teenager into my adulthood, I personally really struggled with my own mental health. And therapy actually was a really big part of my life during that time. And so through my own lived experiences, I've personally really become a strong advocate for therapy. I initially thought I wanted to study psychology and become a therapist so I could support people through their own struggles. As I was kind of going through my studies, I kind of realized, mental health is a lot more complex than we, lay it out to be. And so I made the switch ultimately to study sociology, which really ultimately shifted my perspective. I began to see how systems, access, and social structures really play a huge role in people's well-being. And again, how systems really aren't set up sometimes to support those people.
Oh, I know, and the stigma within systems, right? Like, I think
Yeah.
that's one thing. A lot of people don't talk about it, that institutional stigma, whether
Mhm.
it's in schools or workplaces. Do you want to share a little bit about that, like, so people understand what that institutional stigma is about?
I think it really kind of comes from a place of like that systems thinking.
Hmm.
Like with my own interest in my career, so really focusing on those environments and relationships that support mental wellness. Ultimately before people reach that crisis point is kind of what led me in that direction.
Yeah, no, thank you so much. And I know you touched on the Rural Mental Health Network. At Stigma-Free Mental Health, we're very passionate with our rural mental wellness programming, Rural Minds Matter, and I want to hear a little bit more about the Rural Mental Health Network. Can you share a little bit more about that?
Yeah, really glad you asked about that. So the Rural Mental Health Network is a community-led initiative that ultimately supports rural and remote communities across Alberta to strengthen mental health and well-being in a way that makes sense locally. So what makes the network unique is that it focuses on upstream, preventative, and relational approaches to mental health rather than offering a one size fits all. So it supports communities to identify their own priorities, build on existing strengths, and really lead action from within the community. So at its core, it's really about shifting mental health from something that happens only in systems or services to something that is supported through relationships, connection, and community leadership.
Right, and grassroots, right?
Yeah.
Yeah, no, that is so wonderful. And then when you're talking about this network, so the community animators really are on the ground and making this possible?
Yeah. Andrea, I'm just curious, like when you hear the word community animator, like what kind of comes to mind for yourself?
Somebody who animates, so what they would be doing in the community is making it come alive, making it have that sense of belonging, connection. An animator, in my view, somebody who creates a lot of color and creativity. And yeah, I think that's an amazing word,
Yeah,
animator.
thank you. Yeah, and it's, essentially exactly what you just said. It's, a community resident that, really wants to step up into a leadership role essentially. And they have to be really creative because, not one community is a one size fits all. And so animators, again, have to just be really adaptable, be able to be flexible in terms of how they're meeting their community and kind of where they're at. So yeah, animators aren't clinicians or experts. They're really connectors and facilitators. So they're, really focused on listening, creating those collaborative plans, amplifying local voices, and ultimately just building on the strengths and lived experiences already in the community.
Right. So they conduct projects and then engage the residents in the community. Is that how it works?
So they, so typically when an animator comes into this role, they're actually reaching out to other community members around them and inviting them in to come have a conversation with them and start to really dig into the issues or problems that could be present within the community. But it's really a collaborative effort. The animator might lead the conversation, but it's the group and the ability to move forward all together. So, there's no formal credentials required in this role. It's really about animators bringing their lived experience, their local knowledge, and ultimately just committing to wanting to support their community.
Yeah, and this is an Alberta provincial, right?
Yes.
Yeah, and how many approximately, I know it might be hard to know exactly, the number of community animators across the province of Alberta?
Yeah, so currently we have, I think, approximately around 200 animators that are a part of the Rural Mental Health Network.
Wow, that is amazing. Love to hear that.
Mm-hmm.
Okay, so what makes rural mental health different and unique? So I'd love to hear your perspective and insight on how rural mental health, how is it different from their urban counterparts?
Right. Yeah, I think what's important to know is the context people are living in rural communities. So, there could be certain challenges like long distance travel. There could be potentially fewer services, and there might be a limited anonymity when it comes to accessing support. So that can make it feel a little bit more complicated when they're, in living in rural communities. But there can also be a strong cultural like cultural expectations. So around self-reliance, or like just push through. You're gonna get through this, which also can make it harder for people to talk more openly about mental health and address the stigma. But at the same time, rural communities have powerful strengths. They tend to be deeply relational with strong connections, shared history, and a strong sense of people. So, people know one another, they show up, and they, ultimately really care about their community.
Yeah, especially agricultural communities, right? Like we see those farmers who have that grit and get through it and suck it up kind of attitude sometimes. And it can be very detrimental for people's mental health to think that they have to do it all on their own.
Mm-hmm. Yeah. And, I think just through, the Rural Mental Health Network, I've really just seen, what tends to be the most effective is really that community-led relational approach, so the building trust, reducing isolation, and just creating space for conversation and in kind of everyday settings. So, mental health is, can be supported through connection and local leadership. And, it becomes something people can engage with, and it just, creates that safe space for them.
Yeah, and I always think of the coffee shops where a lot of people do gather, and that's a type of peer support, right?
Mm-hmm.
So it's where people are finding that connection and that belonging for sure within their community with other people, and that's so good for their mental health. So what have you learned from working with rural communities and community members? I know you mentioned a few things, but what are some of your learnings?
Yeah. Just before I jump into that, Andrea, I just,
Yeah.
like you touching on the coffee conversations, that is, essentially how animators can start to involve community members, is inviting them into kind of a local space where they have coffee and food. And again, it's really that relational conversation piece that ultimately starts to build that relationship. And then it evolves hopefully into working towards an initiative within their community. So yeah, I just wanted to touch on that too, because I definitely think sometimes where animators start from.
Yeah, I love it. Yes.
Yeah. But yeah, one of the things I've learned from working with rural communities and community members is just how much strength, care, and leadership there really is that already exists at the local level. So again, people really do care deeply about their communities, and they understand the challenges. They also understand what works and what matters. So over the last few years, moving myself from Calgary to Okotoks, it's also really shifted my own perspective. Being a part of a smaller community has helped me better understand the realities of rural life. The closeness, the importance of relationships. It's allowed me to relate to community members that are involved in the network, not just through my role professionally, but also through my own lived experience of being a part of the rural community. Yeah.
Amazing. I think when you're living it, you really understand it. You have that lived experience for sure. I'm starting to really feel that myself. I came from Medicine Hat. I was there for 2 years, and that was 75,000 population, and coming to 33,000 in Moose Shop. I gotta say, I really love it. So it's a whole different world.
Yeah.
Yeah.
And I've been in this role for just over a year, and for me, it really, kind of brought it full circle and into life when I attended the first provincial exchange of this past year. And it's the provincial exchange isn't just a conference. It's ultimately a space where we invite the animators and now the network to come together over a couple of days, and it's an opportunity to say thank you and celebrate all the things and the ways that people have shown up for their communities. And I don't know, for me, it was kind of the first time where I saw everything that we've been working towards kind of like come together. So the animators I had supported through training, some of the organizations I had connected with, and then community members across the province were there, sharing stories, celebrating one another, and really reflecting on what they've built in their community.
When's the next one?
Yeah, we're just at the very beginning of planning everything out. So we're gearing up for October 2026.
Amazing. So can people like Stigma-Free Mental Health or organizations come to that? Like, is that open to the community as well, or is it more within Canadian Mental Health Association?
Yeah, so I would say currently it's for the people that are part of the Rural Mental Health Network. So people that are working together towards kind of these different initiatives. I know as a team we're having conversations around what that kind of looks like for the future. But unfortunately, it is just for right now for our people that are a part of the network.
Yeah, no, that's great. Okay. So how do systems and community context shape mental well-being in rural communities? I know you have the systems approach. A lot of people may not even know what that means. So I was wondering if you could dig into that a little bit.
Yeah, so I think it's instead of really focusing on the on the community, what it really is taking a broader lens and looking at things from high above. So it could be looking at your local government, it could be looking at different nonprofits within your community, and really looking at those processes and how they feed into how they work with community members is ultimately how I see systems thinking. And again, so if you're noticing a barrier or community members can't access certain things, it's really good to kind of take that step back and really look at it from a broad view, and then hopefully be able to kind of get into that individualistic lens.
Right. So that macro versus micro.
Yeah, exactly.
Okay. Yeah, no, that's very interesting. And I've heard of systems thinking before. It was hard to grasp in the beginning, but I think I got a real grasp of it now. And talking to you today helps bring some light into that. So thank you.
Thank you.
Yeah. So how can people get involved? Let's talk community and people who are inspired by this podcast and what you're up to.
Yeah, so I think what's important to know is that currently the network is only open to rural Albertans. There are a few different ways people can get involved within Alberta, and it really starts with joining the Rural Mental Health Network. So when someone becomes a part of the network, they're connecting with other rural Albertans who are passionate about mental well-being. So it's ultimately a space to brainstorm, collaborate. You have meaningful conversations with people who truly understand rural life and are looking to work towards bettering their mental well-being within their community. So right now we have two different roles. So we're trying to give people more of the flexibility and choice about how they want to be involved and stay connected. So people that want to potentially participate in conversations, they maybe want to learn some things, access different resources. Those would be our network supporters. And then we have those other community members that maybe want to take more of that leadership facilitative role, and that would be for our community animators. So there is a training portion to becoming a community animator. It takes place over the course of a couple of months. And then once they're through that phase, they get brought into a different space within the Rural Mental Health Network, where they're able to connect with other community animators that are also doing that type of work.
How exciting. I love this, that you're engaging the province of Alberta and the people who are passionate about mental health and giving people, they probably feel really empowered because they're able to do something meaningful and work with your organization. So I think that's wonderful.
Yeah, it really is. And, I think like having started from last year in this role to now, we, have, looked at opening up the network, and now these new roles are coming in. So again, just being able to give people that choice, I think ultimately is, how the Rural Mental Health Network works is in collaboration and really meeting people where they're at.
Yeah. How do people find you?
Yeah, so if people want to Google Rural Mental Health Network, we have a website that will pop up. We also have a general email you can reach out to. It's rmh@cmha.ab.ca. And myself or somebody on the team will be able to reach out to you and connect with you and get back to you.
Awesome. I love it. Thank you so much for joining me today, Emily. Stay on the line. I'd love to chat further a little bit and say goodbye to you. Is there anything else you'd like to add as we close up? Maybe some inspiring words for people, someone who's struggling, or anything you want to add?
Yeah, I just the honor that it is to be able to come on as a guest and participate in the podcast, is just phenomenal. I just, very honored to have been asked to be a part of this. And, if there are people that have further questions that are tuning in right now, and again, like I said, feel free to reach out to the team, reach out to myself, and we'd be more than happy to chat further.
Thank you so much, Emily. So you are listening and watching to Stigma-Free Voices, just letting people know that we will be having our podcast featured on Spotify. That will be up in the upcoming weeks. We will do a little newsletter, get the word out there to our many subscribers. And as well, too, just want to let people know that if you are watching this after the fact on Facebook, you find it on YouTube, anything at all, please do feel free to share. We want to get the word out there even further about our podcast. And Emily has had a lot of really great things to say. So let's all work together to create that connection, belonging, and community, right? I love it. And we can do that through our podcast as well. All right. Thanks, Emily. And thank you, everybody, for tuning in. Have a wonderful day.
Thanks, everyone.